Hi everyone. Male pattern baldness or androgenic alopecia, it is one of the most common problem faced by males in their lifetime. When we come to know, it's like we are getting bald, usually it's very late. Okay. So in this video, I'll be talking about various stages of male pattern baldness. Okay. So in the initial part of the video, I'll be talking about one of the most common classification or staging system used by the dermatologist, that is Norwood classification or staging of male pattern baldness. In the second half of the video, I'll be talking about the significance why we should know what is our stage. Okay. So myself Dr. Kiran K C, I'm a dermatologist, hair transplantation surgeon working in Haldwani, Uttarakhand. Let's start with the initial part of the video, that is staging of male pattern baldness, that is Norwood classification or staging of male pattern baldness. There are totally 7 stages. Okay, let's start with stage 1. In the stage 1, the frontal area has not receded back. The hairline is intact. Only the hair strands in the frontal and the temple area has thinned out or reduced in density. In stage 2, the temple area has receded back, whereas the frontal or the center area has not receded back. So patient who are in this stage 2, males who are in this stage 2, male pattern baldness or androgenic alopecia, if you keep your hairs long and do a hairstyle, okay, if you keep your hairs long, you will be able to cover or hide your temple baldness. Only the slight, it has receded slightly, so you will be able to hide it. Okay. In stage 3, okay, along with the temple area, the frontal area also has receded back. Okay, in this you can see that M shape. Okay, M shape of receding back. Okay, the temple area has receded still more than compared to the stage 2, along with the frontal area also has receded. In stage 3, you also can find the vertex area has started balding or thinning. Okay, slight amount of thinning or balding being present. Okay, in stage 4, okay, along with the frontal area which has resided still more back, the temple, frontal, both resided still more back, there is a big vertex balding present. The temple and frontal area has resided still more back compared to stage 3, along with there is a big bald patch in your vertex area. This is stage 4. In stage 4, there is a thick strip of hair, okay, thick dense hair, okay, which separates the frontal area from the vertex balding, frontal balding from the vertex balding. Okay, in stage 5, okay, the strip of hair which was separating the frontal balding from the vertex balding has thinned out. The hairs in the strip has become thinner and reduced density. Okay, in stage 6, the strip of hair separating the frontal and vertex balding has disappeared, and both the frontal and vertex balding has formed a big single patch of balding. The whole area is bald, only few hairs, okay, few strip of hairs may be present at the vertex area. Stage 7 is complete balding. Okay, complete. The frontal vertex is completely gone. Maybe only the side hairs which are present, sometimes these are also thinned out. Okay. So now as we understood, okay, this is the staging, the total 7 stages I have described. So now let's understand what is the significance, why we should know what is our stage. Okay, this is to know what to expect, okay, with the treatment. Okay, particularly stage 1 and stage 2. Okay, you don't require hair transplantation. Okay, basic treatment, according to basic treatment is tablets, solution, shampoos, even PRP or GFC will be able to maintain, okay, we will be able to preserve your hair and also increase the density in stage 1 and stage 2 balding. Okay, in stage 3, okay, it's like if you want to go for hair transplantation, it's the decision of the patient. Okay, it's like I usually, whenever stage 3 patient comes in, I talk about hair transplantation, but I don't say that you have to go. Okay, it's like it has gone back surely, but even with the treatment, if the density, okay, of the existing hairs has increased, it gives a very good results. Okay, appreciable result is there, and appreciably hair can be maintained in a very good state. Okay, whereas stage 4 and stage 5, I really insist my patient to go for hair transplantation, because even though your existing hairs, okay, if the density is increased also, if it is preserved also, you don't get that. It's a cosmetic problem. Okay, this is, so you don't get that visible improvement. Visible means it's not like your satisfactory improvement, satisfactory results, even though if existing hair becomes thicker also. Okay, density is increased by solutions, PRP, GFC also. I always feel in stage 4 and stage 5 patient will not be happy. So I always suggest, along with the hair transplantation, going for the basic treatment and PRP, okay, or GFC. Okay, next in stage 6. Okay, stage 6, that is complete. The as I told, is the frontal balding and vertex balding has both of them have got together and formed a huge patch. So in this, hair transplantation is a must. Okay, just going for some topical solution, PRP will not help you at all. Okay, hair transplantation, you should go in stage 6. But in stage 6, okay, to cover the huge area, it always depends how is your donor area, occiput area, how is the donor area, how is the thickness of your hair in the donor area. So this will determine whether we will be able to cover the whole area or the most of the area with the dense hair, okay, in hair transplantation. So the results is like, it will surely depend on your donor area density. In stage 7, even hair transplantation, even the traditional way of hair transplantation, okay, taking from the donor area may not give you good results. I suggest to you use artificial hair, that is hair wigs. Okay, so hair transplantation, no use. Body hair transplantation can be tried, that is taking hair follicles, okay, hair follicles from other part of the body, particularly beard, chest area, other areas. But always the hairs, but it's body hair, chest hair, you can see it does not grow so long. So the results, if you transplant also, it is not very good results. I have done body hair transplantation also. The results usually are not satisfactory. Okay. So in this video, I'll completely explained all the stages and also I have explained the significance. Thank you. Please like, share and subscribe. Wait for the next informative videos. Thank you.